Hello guys, welcome back to my YouTube channel. Today I'm going to discuss about the infratemporal fossa. Here from this video you will learn about the bony boundaries of the infratemporal fossa, the contents and about the mandibular nerve and the otic ganglion. Infratemporal fossa is an irregular space below the temporal fossa. This region is the temporal fossa and this region is the infratemporal fossa. When we talk about the bony boundaries, infratemporal fossa has a roof, then a medial wall and an anterior wall. It is open inferiorly as you can see here. The roof is formed medially by the infratemporal surface of the greater wing of the sphenoid bone. Here this is the maxilla, that is infratemporal surface of the maxilla. Then this is the pyramidal process of palatine bone. This is the pterygoid hamulus. This is the sphenoid bone. You can see the lateral pterygoid plate here and the infratemporal surface of the greater wing of the sphenoid bone. And these are the foramina, foramen ovale and foramen spinosum of the sphenoid bone. And you can see the tympanic plate and tegmen tympani here. Then this is the styloid process and external auditory meatus here, the mandibular fossa or articular part of the mandible. So when we talk about the roof of the infratemporal fossa, the roof is formed medially by the infratemporal surface of the greater wing of the sphenoid bone. You can see this part is the roof. So this roof separates this infratemporal fossa from the middle cranial fossa. The features of the roof are the spine of the sphenoid bone. Here, this is the spine of the sphenoid bone. Then the foramen spinosum and foramen ovale and infratemporal crest. Here. What are the features of the roof of the infratemporal fossa? Those are, here easily you can remember, the spine of the sphenoid bone. Then here the foramen spinosum, foramen ovale and infratemporal crest. Those are in the medial aspect of the roof. When we talk about the lateral aspect of the roof, the infratemporal fossa is communicate with the temporal fossa behind the zygomatic arch. Medially, the fossa is bounded by lateral pterygoid plate of the sphenoid bone and the pyramidal process of the palatine bone. Anteriorly, the fossa is limited by the posterior surface of the body of the maxilla. Here, the medial and anterior wall, this is the medial wall and this is the anterior wall. And those two walls meet below, but they are separated by this pterygomaxillary fissure. Here, this is the pterygomaxillary fissure and this you can see a small foramen here. It is the spinopalatine foramen. And here, this is the pterygopalatine fossa. As you can see here, in the upper end of the pterygomaxillary fissure, there is inferior orbital fissure. This is the pterygomaxillary fissure and its upper end, you can see inferior orbital fissure. Infratemporal fossa communicates medially with the pterygopalatine fossa, as you can see here. And it communicates through the pterygopalatine fossa through pterygomaxillary fissure and with the orbit through the inferior orbital fissure. As posterior relations of the infratemporal fossa, there is temporomandibular joint, tympanic plate and styloid process here. These are the posterior relations of the infratemporal fossa. Let's see what are the contents of the infratemporal fossa. The main contents are the mandibular nerve and its branches, otic ganglion, cauda tympani nerve, first and second parts of the maxillary artery and their branches, pterygoid venous plexus of veins and maxillary vein, spinomandibular ligament, tendon of insertion of temporalis muscle, and medial and lateral pterygoid muscles. Those are the main contents of the infratemporal fossa. In this picture, you can see some of the muscles in the infratemporal fossa. Here, this is the lateral pterygoid muscle. This is the temporalis muscle, which is a content of temporal fossa. And here you can see clearly lateral pterygoid muscle. This is the lateral pterygoid muscle, and this is the upper head of the lateral pterygoid, and this is the lower head. And then this is the medial pterygoid muscle. Here, this is the superficial head of the medial pterygoid, and this is the deep head of the medial pterygoid muscle. Although the temporalis muscle is not a content of infratemporal fossa, this insertion part or the tendon of the temporalis muscle is a content of infratemporal fossa. You can see clearly the tendon of the temporalis muscle here. Those are the muscles that belongs to infratemporal fossa. This spinomandibular ligament is also a content of this fossa. Here, this is the external carotid artery, and this is the terminal branches. These are the two terminal branches, superficial temporal artery and maxillary artery. In the infratemporal fossa, you can see only the first and second parts of the maxillary artery and their branches. You can see clearly this part is the first part of the maxillary artery and this part is the second part, and you can see the branches and their distribution as well. The course and the distribution of branches of the maxillary artery I discussed in a previous video. So you can have a look on that video as well. I will put the link on the description box. I will tell you roughly what are the branches of first and second part of the maxillary artery. Here you can see the green color part is the first part and yellow color part is the second part. From the first part, there are five branches: deep auricular artery, then anterior tympanic artery, middle meningeal artery, accessory meningeal artery, and inferior alveolar artery. From the second part, the branches are distributed to the muscles of mastication. So the a branch to the masseteric muscle and another branch to the pterygoid muscles, pterygoid branch here, and another two branches to deep temporalis muscle. Those are deep temporal arteries, and here another branch called buccal artery. From this picture, you can see the nerves of the infratemporal fossa. Here is the trigeminal ganglion, and you can see the three divisions of trigeminal nerve: ophthalmic division, and maxillary division, and mandibular division. So the mandibular nerve is the nerve which can be seen in the infratemporal fossa. When we talk about the mandibular nerve, this nerve is the largest of the three divisions of trigeminal nerve, and it has a large sensory root and small motor root. The sensory root arises from posterior end of the lateral surface of the trigeminal ganglion in the middle cranial fossa. The motor root arises from the pons and it passes under trigeminal ganglion. Two roots unite with each other in the foramen ovale or just outside the foramen, and the trunk thus formed enters into the infratemporal fossa. You can see its entry into the infratemporal fossa through foramen ovale. Let's have a look on the extracranial course of the mandibular nerve. In the infratemporal fossa, the short trunk of the mandibular nerve passes between lateral pterygoid and tensor palatine muscles, and it soon divides into two divisions as anterior division and posterior division, or anterior trunk and posterior trunk. Here, this is the largest part. This largest trunk is the posterior trunk of the mandibular nerve, and this smallest part is the anterior trunk of the mandibular nerve. Let's see the branches of the anterior trunk or the anterior division. There are four main branches arises from the anterior trunk of the mandibular nerve. Those are deep temporal nerves and the buccal branch and nerve to pterygoid, lateral pterygoid muscle and nerve to masseteric muscle. The buccal branch, here you can see the course of the buccal branch. This part is the buccal branch, and buccal branch is the only sensory branch of anterior division. This is the only sensory branch. All other three branches are motor nerves. They have motor functions. This buccal branch passes anteriorly between two heads of the lateral pterygoid muscle to supply the skin of the cheek and buccal mucosa lining the buccinator muscle. The nerve to lateral pterygoid muscle. Here, this is the nerve to lateral pterygoid muscle. It enters into the deep surface of the lateral pterygoid muscle. These are the deep temporal nerves. Those nerves pass superiorly into the infratemporal fossa where they enter into the deep surface of the temporalis muscle. You can see the cut surface of the temporalis muscle, and you can see how these nerves enter into the deep surface of this temporalis muscle. Nerve to masseter muscle. This is the nerve to masseter muscle. It leaves the infratemporal fossa through the mandibular notch to enter into the deep surface of the masseter muscle. When we talk about the posterior trunk of the mandibular nerve, you can see it is the largest one, and there are only three terminal branches as auriculotemporal nerve. This is the auriculotemporal nerve. Then inferior alveolar nerve. This is the inferior alveolar nerve, and then lingual nerve. This one is the lingual nerve. When we talk about the auriculotemporal nerve, it arises by two sensory roots. You can see the two sensory roots here. Those two sensory roots goes anteriorly and posteriorly to this middle meningeal artery. You can see very clearly here. Then those two sensory roots unite behind this middle meningeal artery and form a single nerve. Auriculotemporal nerve receives postganglionic parasympathetic fibers from the otic ganglion for secretomotor supply of the parotid gland. It leaves the fossa by passing the posteriorly in relation to lateral aspect of the spine of the sphenoid bone. And it hooks around the back of the neck of the mandible and enters the parotid gland to supply secretomotor fibers. This nerve goes to the parotid gland. After leaving the parotid gland, it enters into the temporal region, and then it supplies tragus, upper part of the lateral surface of the pinna, and external auditory meatus, tympanic membrane, as well as the skin of the temple. This is the inferior alveolar nerve. It passes vertically downward, you can see, between lateral and medial pterygoid muscles after giving off the nerve to mylohyoid. Here you can see the nerve to mylohyoid. This is the mylohyoid muscle, and you can see the branch very clearly, nerve to mylohyoid. After giving this mylohyoid nerve to mylohyoid muscle, it enters into the mandibular foramen. Here there is a mandibular foramen, and it enters into this foramen to travel in the bony canal. It travels in the bony canal. Then it supplies the mandibular teeth and gums. Its branch called mental nerve. You can see this is the mental nerve. It leaves through the mental foramen. And then it supplies the skin of the chin and lower lip. Inferior alveolar nerve block is used in dental practices. For this, the anesthetic solution is injected anterior to the lower end of the sphenomandibular ligament. This is the sphenomandibular ligament. So, the anesthetic solution is injected anterior to the lower end of the sphenomandibular ligament. Anterior means this area. You can see sphenomandibular ligament is a posterior relation to this inferior alveolar nerve, which is felt through the opened mouth of the patient. This can be felt through the open mouth of the patient. When we talk about the lingual nerve, you can see this lingual nerve here, and it is located anterior to the inferior alveolar nerve. It is joined by cauda tympani nerve, which is a branch of facial nerve at an acute angle. Here, this is the cauda tympani nerve. In this way, the lingual nerve carries the cauda tympani nerve Then it leaves the infratemporal fossa by passing in close contact with the mandible just inferior to the last molar teeth. Then it travels in the submandibular region on the surface of the hyoglossus muscle. Here the submandibular ganglion is suspended from the lingual nerve. You cannot see the submandibular ganglion here, but remember that through these connections, lingual nerve distributes preganglionic parasympathetic fibers belonging to coda tympani nerve to the ganglion and receives postganglionic parasympathetic fibers for sublingual salivary gland. Finally, lingual nerve enters into the oral cavity here, and it supplies general sensory fibers and distributes taste fibers to the anterior two-thirds of the tongue. Here you can see the how nerves are going, or nerves apply to the tongue and submandibular gland as well as sublingual gland via the lingual nerve. This is the lingual nerve here. This area is the infratemporal. This area belongs to infratemporal fossa. You can see otic ganglion here. This is the coda tympani nerve, and how coda tympani nerve joins to this lingual nerve. And this is the lingual nerve, and then some branches, a branch coming to this submandibular ganglion, and it supplies to the submandibular salivary gland. Here you can see the further pathway of the lingual nerve here, and then it supplies sublingual gland as well. The dotted blue color pathway is the postganglionic parasympathetic fibers, and the dotted red color one is the postganglionic sympathetic fibers. You can see this is the tongue, and how lingual nerve supplies to the anterior two-thirds of the tongue. Here the coda tympani nerve carries sensory fibers for taste sensations from anterior two-thirds of the tongue, and preganglionic parasympathetic fibers for rely in the submandibular ganglion. Then as the lingual nerve leaves the infratemporal fossa, you can see the coda tympani nerve also joins to this lingual nerve, and then this lingual nerve travels to this submandibular region on the surface of the hyoglossus muscle. You can see the preganglionic parasympathetic fibers are distributed to this submandibular ganglion, and from this submandibular ganglion it distribute postganglionic parasympathetic fibers to the submandibular gland. Let's move on to this otic ganglion. We have to know for few details about this otic ganglion as well. Otic ganglion is one of the parasympathetic ganglion which is rely station on secretomotor pathway of the parotid gland. That means the secretomotor fibers to the parotid gland goes through this otic ganglion. Though the otic ganglion is located close to the mandibular nerve, it is functionally related to the glossopharyngeal nerve. Otic ganglion is located deep in the infratemporal fossa just below the foramen ovale. The otic ganglion lies between trunk of the mandibular nerve on lateral side and tensor palatini muscle on medial side. When we talk about the connections of the otic ganglion, the parasympathetic route is formed by lesser petrosal nerve, which is an indirect branch of the glossopharyngeal nerve. This is the lesser petrosal nerve, you can see. So, this forms the parasympathetic route. Lesser petrosal nerve forms the parasympathetic route. It enters into the middle cranial fossa through roof of the middle ear, and then it enters into the infratemporal fossa via foramen ovale or foramen innominatum. Thus, the fibers of the glossopharyngeal nerve that are relayed in the otic ganglion. You can see the glossopharyngeal nerve here. So this is the inferior ganglion, and you can see how the parasympathetic fibers are coming through this lesser petrosal nerve. Then the other connection is postganglionic secretomotor fibers. So the postganglionic secretomotor fibers join the auriculotemporal nerve, which carries them into the parotid gland. You can see the auriculotemporal nerve here. This is the parotid gland. You can see two sensory roots here, and you can see those two sensory roots are encircling this middle meningeal artery, and this is the auriculotemporal nerve which goes towards the parotid gland to supply secretomotor fibers. Then the other connection is motor fibers, which is the communication from the nerve to the medial pterygoid, which passes through the ganglion to supply tensor palatini and tensor tympani muscles. Finally, there are postganglionic sympathetic fibers reach the ganglion from the sympathetic plexus around the middle meningeal artery. These fibers pass through the ganglion uninterrupted and join the auriculotemporal nerve for vasomotor supply to the parotid gland. Here, the dotted lines in red color represent postganglionic sympathetic fibers which goes towards the parotid gland via auriculotemporal nerve. So I hope you could learn about the infratemporal fossa, the bony boundaries, the contents, and further details about the extracranial course of the mandibular nerve as well, and also which is otic ganglion, which is one of the important parasympathetic ganglion. So if you like this video, please subscribe into my channel for further videos and further details in anatomy. Thank you for watching.